No anesthesia, no antibiotics, no x-rays, no germ theory. For over 300,000 years, that was the entire medical toolkit humans had. Nothing. And yet they survived broken bones, they survived infections. Some of them even survived brain surgery. Not with luck, with knowledge. Knowledge so effective, parts of it are still used in hospitals today. Here's how ancient humans kept themselves alive without a single hospital, pill, or doctor's degree. Before infection, before fever, the first thing that could kill you was simple: bleeding out. Ancient Egyptian doctors left behind the Edwin Smith Papyrus, a document dating back to around 1600 BCE that describes 48 real surgical cases. Examine, diagnose, treat, step by step. This wasn't guesswork, this was structured medicine. Their tools were things sitting in your kitchen right now. Honey was packed into wounds constantly, appearing in roughly half of all Egyptian remedies. It draws moisture out of bacteria and kills them. Hospitals still use medical grade honey on burns today. Moldy bread was pressed onto infected wounds by Egyptians and Greeks 3,000 years before Alexander Fleming discovered penicillin. Willow bark was chewed for pain and swelling, containing the same compound later refined into aspirin. They didn't know what bacteria were, but generations of trial and error had already built something that worked. Broken bones were simple: wood splints, linen wraps, immobilize and heal. But one ancient procedure sounds almost impossible: cutting a hole directly into a living, awake person's skull and having them survive. It's called trepanation, the oldest known surgery in human history. Archaeologists have recovered thousands of trepanned skulls, and here's the stunning part: many show smooth, healed bone around the hole, proof the patient lived for months, sometimes years afterward. In ancient Peru, survival rates hit as high as 75 to 80% by the time of the Inca Empire. Compare that to Civil War battlefield surgeons doing the same operation with metal tools and formal training, surviving barely 10% of the time. The difference wasn't equipment, it was technique, refined and passed down for centuries. Why do it at all? Mostly to relieve pressure from skull fractures, an early, brutal version of a surgery neurosurgeons still perform today. And here's where it gets unsettling, because some ancient cures were dead wrong, and patients paid for it with their lives. Without seeing bacteria, ancient doctors built entire systems to explain sickness. Greek and Roman medicine ran on humoral theory, the idea that four body fluids had to stay in balance. It gave doctors a framework, and some of their responses, like rest, diet, and herbs, accidentally helped anyway. Others didn't. Bloodletting, deliberately draining a sick patient's blood to rebalance them, persisted for over 2,000 years and likely weakened more people than it saved. One of history's biggest lessons in confident, well-meaning harm. But alongside the wrong ideas came real insight. Communities facing plague isolated the sick centuries before anyone understood microbes. The word quarantine comes from 14th century Venice, where ships were held 40 days before docking. They didn't know why it worked, they just knew that it did. Here's the pattern across every culture we've looked at. Ancient medicine wasn't guessing blindly, it was empirical, built from watching outcomes across hundreds of generations, keeping what worked even without knowing why. They didn't know honey killed bacteria. They just knew wounds packed in it healed. They didn't know willow bark contained salicylic acid. They just knew it brought the swelling down. That's not primitive thinking. That's the scientific method, running in slow motion, refined over thousands of years instead of a handful of lab trials. It's exactly why modern researchers keep returning to ancient medical texts and finding real, testable treatments hiding inside what used to be dismissed as folklore. So the honest answer to how ancient humans survived without modern medicine isn't luck, and it isn't magic. It's thousands of years of careful observation, passed from healer to healer, refined one patient at a time, sometimes brutally wrong, but often shockingly right. We didn't invent medicine in a lab. We inherited it from people who had none of our tools and all of our determination to survive. If you want the next one, how many times did ancient humans actually have sex? Hit subscribe. This channel is going deep into everything about ancient human life they don't teach you in school.